Okay, so here we're going to talk about developing a healthy breeding program. And then once again, uh, you're selecting against disorders, but you're also selecting for a quality dog. So, having an ugly, healthy dog is not a desirable thing, all right? But we need to, as a breeding goal, maintain and enhance the quality of the breed. And that's your number one thing for breeding is maintain and enhance quality. Otherwise, you might as well just be breeding mutts, okay? And do not limit the genetic diversity of the population. And again, popular sire syndrome is your number one thing there. But looking at entire populations, it's also avoiding the loss of quality lines. So people who are retiring lines, people that have frozen semen on quality dogs of the past that they're going to stop paying for storage. That you're going to lose those dogs as well if those dogs aren't well represented and do represent quality. Utilizing those dogs. There are some breeds that are purchasing frozen semen from the breeders that don't want to maintain that semen anymore, and that semen is now owned by the parent club. And that if people want to breed to those dogs, they contact the parent club. Now, there's all sorts of legal and all sorts of stuff involved with it, but at least they're doing something to, that is having to do with maintaining genetic diversity and maintaining the quality of the breed. So there are lots of different ways that can be done. Genetic disease control, although I have it listed second, is not, it's not that it is secondary, but it goes along with breeding a quality dog. What do we want to do for genetic disease control? Number one, do not produce an affected animal in the next breeding. Okay, is avoid producing affected animals. You could be producing carrier animals, and so that might dictate whether they go to breeding homes or whether they go to pet homes. And certainly you can sell carriers to breeding homes as well, but with the knowledge and eyes wide open that there's a high risk of carrying defective genes, but there are other quality things that may outweigh that. But secondarily, though, we want to decrease the carrier frequency of defective genes. We don't want to just propagate defective genes and breed carriers all the time. Once there's a genetic test, some breeds have decided, well, we don't have to test both parents for an autosomal recessive disease where both parents need to pass on a recessive gene to produce carriers. If we only test the studs and a stud is clear, it doesn't matter what the bitch is. That we'll just breed to the bitches, and we know we'll never produce affecteds. But what we're doing is we're propagating that carrier frequency. Carrier to normal breedings produce 50% carriers. And most genetic diseases and breed do not have a carrier frequency of 50%. So you're adding to that carrier frequency. And we want to select against carriers. Even though they can be healthy, they're totally healthy dogs, we don't want to limit our choices in the future. Once you have several testable genes, and you can say, okay, my dog's a carrier of this, but it's normal for that. I need a dog that's normal for that one. But if you're propagating carriers, all of a sudden, you're not able to select for the best quality dog that you want to breed to because, you've got a high frequency of carriers of this gene, I can't breed carrier to carrier. You've got a high frequency as a carrier of this gene, I can't breed carrier to carrier. Now you're breeding just to not produce affected dogs instead of selecting for the best quality mating that you can have. So you don't want to limit your choices by propagating carriers. You want to be able to increase your choices in the long run. So let's talk about genetic tests. This is not a genetic test for this dog. It's just an agility test. So what genetic screening do you do in your dogs? Next poll question. What genetic screening, so the word is screening, not testing. What genetic screening do you do in your dogs, in prospective breeding dogs? Eye, patella, thyroid. So there's your chick requirements right there and your bred by heart requirements right there. Patella, thyroid, patella. Okay, let's put new stuff in. Eye, patella, thyroid, diabetes, okay. Glucose, cardio, all right, so someone's checking their hearts there, which is good. DM, theoridazine, does that have to do with diabetes, or what is that? Degenerative myelopathy. Okay. DM, see a bunch of those. We'll talk about that. Patella, eyes, thyroid eyes, patella. Okay, so the major things right there, and those are the things we can screen for. All right, so that's what we have available to us. Okay, so there is online in the OFA website your online health survey, and that's an ongoing survey, so you can continue to answer surveys on individual dogs. And on that survey, it asked about health testing. And certainly there are both owners as well as breeders that are filling out that survey. So patella luxation, 36.9% of the respondents said that they checked for patella luxation. It was 100 dogs, thyroid 32.8, and an eye exam 39.5, 107 dogs. And that doesn't represent what our breeders doing, because a lot of owners were filling out that survey as well. But it was pretty consistent. Probably the people that were doing, one of those was doing all three, because you've got about a third of the respondents that answered that question. So what kind of genetic tests or genetic screening do we have available to us? Well, there are tests of the genotype, which is direct DNA tests for liability genes. So if you have a DNA test available, then that's something you can use there. There are tests of the phenotype, which primarily just identify clinically affected individuals. So that's going to be a hip x-ray, that's going to be a heart auscultation, that's going to be a urine test for sugar. So these are tests of the phenotype, or what you're seeing in the dog. Then there's pedigree analysis, which is the identification of carrier risk based on the knowledge of carrier and affected relatives. So this is looking at the pedigree and the knowledge of disease that occurs in the breed. So the Mars test, I talked about the optimal selection, which has the genetic diversity components to it, but it also now includes over 150 genetic diseases, tests for genetic diseases. And this is where the future is going. You're not going to send in an individual test for one gene for one disease anymore. You're going to get a panel test that tests for all known mutations, whether they occur in your breed or not, and then get reported back which of those tests is significant for your breed that you need to pay attention to. It also tests for 20 traits, including coat color, coat types, and morphology. And it's a cheek swab test costing $130. Embark is the other company that does this, testing over 160 genetic diseases, the same thing, traits, genetic diversity testing, and their cheek swab at this point costs $199. So these are two major companies. They don't test for everything, and that's where this whole market and direction needs to go in terms of being able to test for everything with these panel tests, but that's where the future is. It's not just running a single test anymore. So the Canon Health Foundation, in order for them to figure out where to spend their millions of dollars of money that you guys have raised for research, they ask the parent clubs to list what are the diseases of concern to your breed. And then they compile that list so that the diseases and disorders that are the most concern to the most breeds are the ones that are getting research funding. And so that's what they do over time. And so here is the list. Well, before we do that, so we talked about genetic screening. So some things don't have genetic screening. What genetic disorders are you seeing in your dogs? So your dogs are affected with genetic disorders. What are you seeing? This is completely anonymous. I can't trace who answered it or anything else like that. So, LCP is that patella luxation? Oh, leg calf perthes disease. Okay. Eyes, eye disease. What specific eye disease? I think you can answer more than once. I'm not sure. Cataract, okay. Diabetes, heart murmur, disease, leg calf perthes, hemangiosarcoma, mild allergies, hip dysplasia, heart murmur, coat color, wrong coat color, I guess, if it's a disorder. Got a couple of leg Carperthas, which is interesting because the frequency in your breed is extremely low, as reported. Diabetes patella, degenerative myelopathy, hemangiosarcoma. So you have produced a dog with degenerative myelopathy, whoever answered that question, or own a dog with degenerative myelopathy. Hemangio, we'll talk about it. Patella. Okay, so again, the more common disorders that we're seeing, cancer, hemangio, and diabetes. So it looks like your number one malignant cancer, what you're saying is hemangio. We will see what the results tell us. Okay, so let's see what the concerns based on the Canine Health Foundation. Now, the last time they did a survey that was an in-depth survey was 2013. Okay, they do list what their more frequent things are now in terms of their initiatives. They've got an epilepsy initiative, they've got a thyroid initiative, they've got a bloat initiative, and so forth. But they haven't sent out the list, of 1 through 20 or whatever since 2013. So number one across all breeds is hip dysplasia. In parentheses was the prior survey from the AKC, so it shows you how things change a little bit. But 1, 2, and 3 pretty much, or 1 and 2 here, hip dysplasia and epilepsy across all breeds. Those are the most frequent disorders that the breed clubs are concerned with. Allergies has moved up to number 3 from number 5. Hemangiosarcoma is the number one concern for the first malignant cancer that is seen. I don't know that hemangio occurs more frequently than lymphoma, but it is of the most concern because actually lymphoma is very treatable, whereas hemangio at this stage is not. So it's more concern. Hypothyroidism was 3, it's dropped down to 5. Lymphoma at 6. Gastric dilatation or bloat at 7. Patelloluxation at 8. Cruciate ligament rupture at 9, inflammatory bowel disease at 10. The next 10, cataracts, osteosarcoma, atopic dermatitis or atopy as a reflection of allergies, elbow dysplasia, immune-mediated hemolytic anemia, cardiomyopathy, PRA, which used to be in the top 5 and is no longer because we have so many tests for PRA now as the major cause of blindness in most breeds, mammary tumors, retained testicles, and mitral valve disease. So those are the top 20 according to the AKC. On your online health survey, it asked you what is your most serious health problem in the Australian Terrier breed. So these are breeders and owners answering the OFA online health survey. Diabetes is number one at 16.6% of you answering that as the most serious health problem in the breed. Cancer, other types at 11.1. So hemangio was available as an answer, but you clicked off, or people were clicking off other types. So I don't know what other types of cancers that weren't listed because mammary cancer, lymphoma, hemangio, all those were listed on the survey. Allergies, hereditary eye problems, including cataracts, other, vaccine reactions and or autoimmune diseases, skin problems, which is probably allergies for the most part, kidney failure, mast cell cancer, mammary or breast cancer, cardiac issues, and then respiratory problems. So these were what the respondents to the OFA Health Survey reported as your most serious problems, not necessarily the most frequent diseases that they are seeing in the breeds. Now let's look at the frequency data from the health survey. And again, this isn't going to be exactly what the frequency of these disorders are in the breed. A lot of times I look at the numbers and I can tell that these numbers are probably too low, that there are a lot of people putting in for normal dogs and people are not putting in for sick dogs, or a lot of these are too high. But what it does tell us is that the relative frequency of one that is higher than another is probably correct. For the people that, when you have enough people filling out the survey, if one thing is higher on the list and another one's lower, the one that's higher on the list probably occurs with a higher frequency than the other. Okay. So first, disorders by body system. Endocrine was number one, and certainly you've got diabetes and maybe some hypothyroidism that's occurring as your two big endocrine disorders. Orthopedic disease, cancer, eye disease, dental, allergies, gastrointestinal, and then all the way down here, blood, lymph, reproductive, kidney, respiratory. These are lower, lower on the list in that regard. So cataracts are your most frequent, cataracts over 8 years of age are your most frequent disorder listed on the OFA Health Survey. And this is a survey, and there were 271 dogs that were represented on the survey. Now, cataracts in dogs over 8 years of age can be normal. To me, an old dog with, especially Terrier breeds that last well into their teens, they have cataracts. At what age do you say, well, that's abnormal? And at what age do you say, well, old dogs can get cataracts? So it doesn't tell me as much about a genetic problem as much as you've got dogs that live a long time. Diabetes mellitus is your next most frequent at 4.8, which is probably pretty accurate that this is an issue for you in your breed. Dental other at 4.4, and choices aside from other were overbite, underbite, missing teeth, those types of things. So I'm not sure what the other category is. Patella luxation and hypothyroidism at 3.3, seasonal allergies at 3.3, dry eye or KCS, cancer other, pancreatitis, missing teeth, food allergy, and people filling in food allergy. I know as a veterinarian, as most veterinarians know, is that when you have an allergic dog, the first thing the owner thinks is it's a food allergy. Whereas we know that, that less than 20% and maybe even less than 15% of allergic dogs actually have a food allergy. But it's the first thing that most owners go towards in that regard. Flea allergy, ear infections, and chronic ear infection, if it's a low number, that tells me that allergies are probably not a huge problem in the breed. Because your biggest clinical outcome of allergies is, yes, hot spots, but also chronic ear infections, because it's just the reactivity of the ear where there's moisture and low oxygen content, where bacteria and yeast love to grow. That's what you tend to see in these chronically allergic dogs. Aggression, 2.2, and aggression at 2.2 for a Terrier breed, you're probably doing pretty good there. Liver other, colitis, heart murmur, deafness, majority over 8 years of age. Again, that's not congenital deafness. That could be age related as well. Inflammatory bowel disease, hip dysplasia, low on the list, not high on the list. Leg calf perthes didn't really appear, was less than 1% on your health survey. We know it does occur in the breed, but it is a small percent as reported to the OFA. Mast cell tumor, hemangio at 1.5, corneal ulcer, skin tumors and warts, non-seasonal allergies, kidney other, torn cruciate ligament, Cushing's disease, contact allergies, autoimmune skin disease, respiratory other, gallbladder abnormalities, separation anxiety, storm phobia. So your behavioral ones coming in at a lower end of the list. So behavior-wise and aggression-wise, it seems that you've got one of the nicer Terrier breeds in that regard. So let's talk about some of these disorders, and not in the order of frequency, but just get through some of the OFA data. Canine hip dysplasia. Australian Terriers, you have 202 radiographs in the entire OFA database. You rank 164th out of 187 breeds, and this is where you don't want to be number one. Okay, so you're pretty low there. 96% normal, 4% dysplastic. OFA looks at the percentage of excellence, and you have 6.4% excellence, and the average for all breeds is 15.7. And what that's telling me is that you have a dwarf breed. Okay, you have a short-legged breed, and so chondrodystrophy does not produce the best possible alignment and morphology of the hips. So your breed is based on a dwarf phenotype. It's not that your dogs are dwarfs, but you're a short-legged breed, and that is the basis of your breed. So you're not going to have the best possible conformation. But 96% are normal and never going to have hip arthritis. So that's really what you need to concentrate on there. 68.3% good, 21.3% fair, and again, your much higher fair numbers than most breeds is because of the type of conformation that your breed has as a short-legged breed. Your dysplasia is all mildly dysplastic. Average for all breeds is 11.4. So even the fact that you have a chondrodystrophoid or dwarf breed, you have bred away from bad hips and are breeding for normal hips in that regard. And so these hip radiographs also reflect your leg-calf-perthes disease because it would show up as, as hip disease. And the leg-calf-perthes database in the OFA also shows a low percentage. I think it's 3% of radiographs that have been submitted, that there aren't a lot of radiographs in the OFA leg-calf-perthes disease. Leg-calf-perthes disease is the blood vessel that feeds the neck of the femur. So you got the ball, you got the neck, and the rest of the femur. The blood vessel that supplies the neck, it's so small, we only see it in toy and miniature and small breeds. So that vessel, as you breed them down, it gets smaller and smaller, and that vessel collapses. The pressure in that vessel and the narrowness of that vessel does not allow it to pass on the blood. It collapses. The neck of the femur loses its blood supply. You get an aseptic necrosis, so it's not an infection. It's a necrosis due to the lack of blood supply, and then the body fixes that fracture, and you have therefore arthritis in the hip joint because it's all connected in that way, and that's what leg-calf-perthes disease is. Yes?
I think in this regard, with our breed, the OFA testing is at 12 months for LCP, and in our breed at 3 months, they're already repaired.
Yeah. LCP is usually unilateral. It's usually one hip. There are some dogs that have it bilaterally. I have pictures of them, but I didn't put them in here because I was trying to cut down on the number of slides. And hip dysplasia is a completely different disease process. Back in the 1960s, when Dr. Reiser was first documenting hip dysplasia, he said, okay, dogs under 20 pounds have leg-calf-perthes disease, and dogs over 20 pounds have hip dysplasia, and we now know that those are two completely different disease processes. And small dogs do get hip dysplasia. There are small breeds that have a lot of hip dysplasia that we need to deal with. So you're doing good with hips. Patelloluxation, let's talk about that a little bit here. So that's a kneecap that slips out of the groove. And there are a couple of things I want you to know. So first off, you've got 307 evaluations, and you rank number 3 out of 133 breeds. So are you the worst breed with patelloluxation? Probably not, okay? But the fact is, your breed is submitting, is because it's a chick requirement and you guys are doing it, you're submitting patella evaluations. When you submit a patella evaluation, it's not like hips or thyroid. You already know what the result is before you send it in. Okay, so for the 20% of you that are sending in affecteds, you're being honest with yourselves and you're being honest with your breed. Okay, I'm going to do my chick testing, I'm going to submit the results, and yes, my dog has patelloluxation, and it's a breed-related problem, and we're trying to work away from it. A lot of people will not send in an abnormal patella result. A lot of people will not send in an abnormal cardiac result, because you're getting that paper that says abnormal, and then you still have to pay her $15 and send it in. Okay, so at any rate, you are number 3, and you do have an issue with patelloluxation. So what? So let's deal with it. Pomeranians aren't dealing with it, and they're number 1. And less than 100 dogs, I think, have sent in patella evaluations. So it is, and I've spoken to the Pomeranian group, so I can say that with authority. At least you're dealing with it as a problem, and let's work from there.
So what is considered an affected? Is that a grade 1?
Anything more than grade 0. Grade 1 is.
Okay.
But let's talk about the grades, because the grades of hip dysplasia are not the same as the grades for patelloluxation. They do not mean the same thing. The grades for hip dysplasia, and I'll show you that before we finish, actually reflect the genetic liability of your dog for carrying liability genes. The grades for patelloluxation really just tell you at what stage of patelloluxation your dog is at, because most dogs will progress through the grades over time. If you're doing a patella evaluation at 12 months of age, what you're going to find is the vast majority are grade 1s. Because at 1 year of age, that's where most dogs with patelloluxation will be. But as an older dog, they're going to have a higher grade, most likely. So patelloluxation is not a congenital disorder. It is not present at birth. It is not present in a young dog. They have tight patellas, so that they're not born with lax patellas. I palpate the hips and the knees of every single dog that gets spayed and neutered in my practice, and have since the beginning of time, because I was a geneticist before I was a veterinarian. I never feel patella luxation, or hardly ever, in a 6-month-old dog. Okay? And when I have a dog who comes in with a patella luxation, I've had dogs 3 months after I spayed or neutered them come in with patella luxation and pain, and I look at the record 3 months ago, there was no laxity in that knee. Okay, so it's something that occurs. Okay, most dogs it will start as a traumatic event, fell off the couch or did something that started that patella luxation, but the genetic predisposition to that patella luxation was already there. You know, normal dogs don't fall off a couch and have a traumatic patella luxation. That's just not something that happens in a dog that has nice tight ligaments and nice healthy ligaments there. So it can start with a traumatic event, but it's going to be genetic in that regard. The minimum age for OFA evaluation is 1 year. So there are different ways to define the grades. I like this method the best because it really is very straightforward. Grade 1, a movable patella. There is some laxity there, but it doesn't necessarily luxate. Okay? Grade 2, and for the OFA rating, grade 1 already has luxation. You can luxate them. But these are the grades I like to work with because it really tells the story of what patella luxation is about. Grade 1, a movable or lax patella. Grade 2, the patella is in when you find it, and you can move it out easily, but then you bend it and flex and extend the knee, it pops back. It wants to stay in. It pops back in. So it could come out, it can be moving in and out spontaneously, but it wants to stay in. Grade 3, it's out when you find it. You can move it back in, but then you move the leg, it pops back out again. So it now wants to stay out instead of wanting to stay in. Grade 4, it's permanently luxated, you can't move it in anymore. Okay, it's out, it's fixed, the groove is all filled in, and that's where it is. Honestly, when I see a dog in my practice that has grade 2 or grade 3, I'll put them on non-steroidals and see if we can get them healthier, and I'll tell them we want that dog to progress through to grade 4. Because once they're in grade 4, they're not in pain anymore. It's only when it's popping back and forth and those bones are rubbing in each other that you're getting the pain from patella luxation. A little dog like yours does not need a perfect patella system to be able to run around. Okay, but it needs to not be in pain. It's not going to have the normal perfect gait because it is, because things aren't aligned properly, but it's a functional gait in a grade 4 dog. But this is the process of grades. So a dog is not grade 2 genetically, it's grade 2 because that's where it is in its lifetime. And some dogs will stay at grade 2 and not progress. And that's probably a difference in genetics, and maybe when we identify patella luxation liability genes, we can figure out which ones have just a few and which ones have more, and the ones that progress either faster or do progress to grade 4 are the ones with more liability than the ones that don't progress. Left and right patellas will have different grades, but usually only within 1 grade. So if usually I'll say grade 2 left, grade 3 right, and things will move along until they're both grade 3 or one moves to grade 4 or something like that. They usually don't go backward. Once you're grade 3 in a limb, it doesn't go back to grade 2. It is a progressive degenerative disease. As I said, it can begin with a spontaneous luxation, but the predisposition is hereditary. Dogs with mild disease may remain at a lower grade and not progress, and arthritis is what causes the pain with the disease. So that's the story of patella luxation. So the grade at a year of age does not necessarily represent what that dog is going to be in its lifetime. If it's already a grade 3 at a year of age, then yeah, probably it's more severe in that regard. But if a dog's been worked a lot and has a grade 3 versus a dog that's a couch potato and has a grade 1, genetically they may not be very different. Okay, so it really, environment has a big factor in it as well. But the bottom line is hereditary, is heredity. You're inheriting genes for liability. And in dogs with almost the same structure, other terrier breeds Some have much higher patella luxation, some have lower, and it is due to what genes that breed has inherited. Elbow dysplasia, you don't have much of. 17 dogs were evaluated. They were all normal. Elbow dysplasia is really a larger breed disease. It's not seen in the little or short-statured breeds as much. Heart statistics, 30 dogs evaluated, all normal. Again, does that tell me that your breed has great heart system, cardiovascular system? Maybe. On the other hand, OFA heart statistics, you get an affected, you have to mail that in, and a lot of people, they lose it. I lost the paper. I don't know what happened to it, so I never sent it in. But at any rate, 30 normal, and from your health surveys, it doesn't sound like heart disease is a big problem in your breed in that regard. And for little, short-statured breeds and little breeds, mitral valvular disease can be a significant issue. And the fact that you're not reporting a high frequency of mitral valvular disease is telling me that you have a good heart system. Because in reality, what are the heart diseases we see in breeds of dogs? You've got your congenital disorders, aortic stenosis, or subaortic stenosis is the big congenital one we see in frequency. PDAs, patent ductus arteriosus, you can see across any breed, but they're usually low frequency, and other types of valve problems that are congenital. And then acquired diseases, you can got cardiomyopathies, big dogs, okay, where their heart muscles give out, and you see your, and then you see your mitral valvular disease, which is your little breeds. So what you'd expect with your breed if they had heart disease would be mitral valvular disease. You're not really reporting it, so I think you've got a good heart system. Hypothyroidism, let's talk about this one. Hypothyroidism is a diagnosis of autoimmune thyroiditis. So it's the dog equivalent of what's called Hashimoto's disease. It's an immune-mediated destruction of the thyroid gland. And you diagnose it by finding measurable antibodies against the thyroid. So thyroglobulin autoantibodies is what you need to see to call a dog affected. 4.9% of Australian Terriers tested by Michigan State University, 143 samples, are positive for thyroid autoantibodies, okay? And 4.2% are equivocal. And we'll tell you about that, what that equivocal means. The average for all breeds is 7.5%. So your breed has less of a problem with hypothyroidism as most other breeds. Okay, it's not a it's not the higher frequency disease in your breed as it is in most other breeds. If we look at the mixed breed frequency from Michigan State University, it's actually close to 10%. It's higher, but we're looking at a different population. Veterinarians are sending in thyroid profiles on mixed breed dogs because they think they're hypothyroid, they're showing symptoms, and they want to check that out. Whereas in the purebreds, you've got, yes, that population, but much more, you've got people doing pre-breeding screening and looking for it. So you're not really comparing apples to apples when you compare those answers. On the OFA thyroid database, 3% or 8 dogs out of 267 tested are positive for autoantibodies, and 10.1% or 27 dogs are equivocal. And you might say, well, equivocal means that a whole bunch of those can be hypothyroid, and that is the case, but really the majority of those are probably not hypothyroid, and here's why. So first off, let me give you a picture of what hypothyroidism is. Because the thyroid profile is a snapshot of a continuous disease process. So just like patella luxation, your grade is your grade on that day. It wasn't that this is the grade of patella luxation that your dog genetically has, because it's a moving picture, it's a process. Same thing with thyroid disease, it's a moving process. From a range of 2 to 6 years of age, dogs start developing antibodies against its own thyroid tissue that slowly destroys the thyroid tissue. A range of 2 to 6 years, a peak at 4 years of age on average. So once that thyroid tissue is being destroyed, the amount of thyroid hormone that's being produced is going to start to go down. Once you cross a threshold for the amount of tissue that's destroyed, the dog now can't produce enough thyroid hormone to have normal hormone levels. There's a large portion that can be destroyed that still is and still have adequate tissue to produce normal thyroid hormone levels. With low thyroid hormone levels, the brain, the pituitary gland in the brain, says low thyroid levels and produces a hormone called thyroid stimulating hormone, which tells the thyroid to produce more thyroid hormone. Okay, so TSH from the pituitary tells the thyroid to produce more T4. So the hallmark of autoimmune thyroiditis is high autoantibodies, low thyroid level, hormone level, high thyroid stimulating hormone levels. All right? Once the thyroid gland is destroyed, antibodies are produced in response to what's called antigen, something that stimulates antibodies. And with an autoimmune disease, the thyroid tissue itself is the antigen, and it's stimulating the production of thyroglobulin autoantibodies. Once that thyroid gland is destroyed, the stimulus for producing the antibodies is gone, and the antibody level diminishes and dies off. So in end-stage hypothyroidism, you've got low autoantibody levels, low T4, high TSH, okay? And some endocrinologists early on were saying, well, that's good. We have two different types of hypothyroidism. We have autoimmune thyroiditis, and then we have idiopathic hypothyroidism. And in reality, what those dogs with idiopathic hypothyroidism were dogs in the later stages that had no thyroid tissue because they were already destroyed. When they started looking pathologically at those dogs, it was all scarred tissue from immune-mediated destruction, and they could prove that. So equivocal, dogs are called equivocal. They have low thyroid level without autoantibodies. That's why they're being called equivocal. A dog's never going to be called affected unless it has autoantibodies. If the range of autoantibodies is 2 to 6 years of age with a peak at 4, what I recommend is 2 thyroid profiles 2 years apart, anytime between 2 and 6 years of age. You want to do 2 and 4, you want to do 3 and 5, whatever. If you've got 2 normal thyroid profiles 2 years apart, your dog doesn't have autoimmune thyroiditis, doesn't have hereditary hypothyroidism. You need to watch that you're not doing a thyroid profile anytime. They say within 3 months of a vaccination. I say within 6 months of a vaccination. Any vaccination increases all antibodies in the body. It's a massive stimulation of the immune system, and you're going to get an increase of all antibodies. So you'll have false positives after a vaccine. If you're coming in for a vaccine visit, fine, take the thyroid profile and give the vaccine at the same visit, but you're taking the profile before you've given a vaccine. Sick dogs, now this is stuff that Dr. Graves, I think Dr. Graves spoke to you at One National. This is all of what Dr. Graves had tried to point out to you, so I am reiterating what he has told you. Sick dogs have low thyroid hormone levels, all right? Because the thyroid level really tells you about, in general, the condition of the dog. If I run a thyroid and I see it's low in a dog in my practice, I know the dog's sick. I don't know the dog's hypothyroid, but I know the dog's sick. I need to find out what it's sick with. Diabetic dogs have low thyroid levels. There is no correlation or increased risk between hypothyroidism and diabetes. Dr. Graves has said it, now I'm saying it. Okay, there's no correlation. Diabetic dogs do not develop hypothyroidism because of their diabetes, but they do have low thyroid levels because they're sick, because they have diabetes. All right, and then the last thing is this whole test of the antibodies and the T4 and the TSH and the timing is all a phenotypic test, and there's a lot of stuff that varies those levels, and it's not the perfect test to diagnose hypothyroidism. And so the OFA is funding research to try to refine the test or find better tests or identify genes that actually cause hypothyroidism, so you have a genetic test that we don't have to worry about the phenotype to tell us about it. So it's not the best test available. But what I can tell you is your breed does not have a big problem with hypothyroidism. It has a little problem with hypothyroidism, and low T4 levels does not make, or an equivocal result does not make your dog hypothyroid. It does not give a diagnosis of hypothyroidism in your breed. Okay, so that's what I can tell you about hypothyroidism. Eye diseases. So we've got the OFA eye certification registry. So this is between 2010 and 2016. 287 Australian Terriers were examined. Almost 80% were normal. All dogs with a cataract, all Australian Terriers with cataract was 11.2, 32 dogs. Persistent pupillary membrane, iris to iris, was 10.1. An iris to iris persistent pupillary membrane. This is a remnant of a fetal membrane as the eye forms. This is not a genetic disease, and it is the most common eye abnormality seen in normal dogs. It's just a strand, a fetal remnant, and has nothing to do with health in most breeds. In Basenji's, it actually can progress to further disease, inflammation, and blindness, so we know it's significant in Basenji's. In other breeds, you have to completely ignore this. And it is something that's diagnosed at 10% frequency in your breed, and you need to ignore it. It's not a big deal. Cataract, significance unknown. I hate this. This is the ophthalmologist trying to make you feel better and make you feel better about the ophthalmologist by checking off cataract, significance unknown. The dog has a cataract. Shouldn't have a cataract, okay? You need to be honest with it. It's got a cataract. It's not right. Okay, so I don't care whether they check off significance unknown to make them or you feel better. It's a genetic disease, all right? And we deal with it. It's what it is. Persistent pupillary membranes, lens pigment. This is genetic. This can cause later eye disease and blindness, 2.4%. So the ACVO, the Board of Ophthalmologists of the Veterinary Ophthalmologist College, does not recommend breeding any Australian Terrier with a PPM except iris to iris or a cataract, okay? So when we're talking about breeding, we're not talking about age 8 and above dogs that have age-related cataracts. We're talking about dogs less than 8 that have a cataract, and that is a genetic disease. So they recommend not breeding. I'm not all black and white. Can you breed a dog that has a cataract? Yes, but it's got to have a lot of other things going for it that outweighs that. And you need to breed to a dog that doesn't have cataracts and has familial breadth of pedigree, relatives, descendants, siblings that don't have cataracts. You don't want to breed into another family that has that problem. You want to breed away from it. Diabetes in the Australian Terrier. So diabetes is also an autoimmune disease. It's an immune-mediated destruction of the pancreatic beta cells that produce insulin. And I know Dr. Graves spoke to you about this as well. Causes high levels of glucose or sugar in the blood and urine. Clinical signs: increased drinking and urination, increased appetite, weight loss. They can later develop diabetic cataracts. Okay, so here's another caveat for you. Are all cataracts in your breed due to genetics? Well, if diabetes is caused by genetics, yes, but they're secondary cataracts rather than a primary cataract. So your diabetic dogs that develop cataracts, I'm not selecting against them for cataracts. I'm selecting against them for diabetes. They got their cataracts most likely, and you can't separate a diabetic dog that got diabetic cataracts from a diabetic dog that got primary genetic cataracts. There's no way to separate them. They look the same, okay? But at any rate, that could be part of the cataracts that you're seeing in your breed as well. And control with insulin, diet, and glucose monitoring. So Australian Terriers worldwide have a 32.1% odds ratio versus other breeds in becoming diabetic. If they're not the #1 breed, they're pretty much up there. The Samoyeds have diabetes as well, but they have a weird diabetes. They've got a gestational diabetes, like women, like human women. Women, I guess, are humans. Yeah, I think so. So, we know just, women that are pregnant can develop diabetes, and it's purely due to the hormonal influence of pregnancy. That's what Samoyeds have in their diabetes, is gestational diabetes. That's not what you guys have. You have primary diabetes like diabetic people do. So in that regard, you are #1. A 12 times greater incidence in Sweden. So now we have to look at studies. It's not that Sweden has more diabetes than anyone else, but they've at least done studies. In Sweden, they've got this long history of every dog being insured. So you've got insurance data. So now they can do that kind of study and say, look, there's a 12 times greater incidence of diabetes in Australian Terriers than in mixed breed dogs and in other breeds. So again, this isn't Cracker Jack's influence. This is just your breed, and it goes way back. You know, and someone came up to me and said, well, the first dog that was ever diagnosed with diabetes in Australia was in the 1980s. Wrong. You know, that's the first recorded, you know, incidence of diabetes. Diabetes has been going on in Australian Terriers. I mean, I didn't graduate vet school until '82, and I learned in vet school that Australian Terriers had diabetes. So it goes way back. You know, it's not something that just happened. This is the background of your breed. And there's an undetermined mode of inheritance, and we know it's complexly inherited. You know, it's been studied enough to know that this isn't it isn't just a simple gene carrier, normal, you know, affected type of disease process. There are several genes that are involved that are causing diabetes, and hopefully molecular genetic research is going to figure that out for us. So Dr. Rebecca Hess at the University of Pennsylvania is the researcher that's doing the most research right now on diabetes in all breeds. She has a diabetes questionnaire out there for all dogs. There are 10,000, when I spoke to her last week, there were 10,889 respondents, and 96 of those are Australian Terriers. She didn't have the breakdown as to how many had diabetes and how many didn't, but she wants every one of you to fill out the questionnaire on every dog, whether they're diabetic or not. So www.vet.penn.edu/diabetes. Please fill out the questionnaire. Yes? Okay, and the questionnaire is on the club website as well. So, so this is the only research right now that is going on, and she's dealing with pedigrees. She's asking you for your pedigrees. She's asking you for, you know, any test results, and she's looking to separate diabetics from non-diabetics, and she's looking at families. She has several families of Australian Terriers that obviously have familial diabetes, and these can be the subject of later research. She is not doing molecular genetic research right now. She is looking at pedigrees and looking at the clinical presentation of these dogs. You need molecular genetic research to be done. Penn has one of the top molecular genetic veterinary laboratories in the world, so it's the right place to get this research done. But that's not what is currently going on, and we'll talk about that in a second as well. Okay, lastly, I want to talk about degenerative myelopathy. So here's a survey. Do you personally know, have you seen an Australian Terrier who was definitively diagnosed with degenerative myelopathy, yes or no? Let's answer this question. I know when I asked what disorders are you seeing in your dogs, and someone put down degenerative myelopathy, and I'm thinking it's because their dog has tested homozygous affected or at risk with DM, not necessarily that it has clinical signs. So I want to talk about it. We're going to get into this in depth because it's a question that was put to me, and you are not the first breed that I'm dealing with this issue with. And I've spoken to the folks in Australia, and let's get into it and break down what we know and what we don't know. Okay, so 100% of you have said no, that you do not personally know of an Australian Terrier definitively diagnosed with degenerative myelopathy. Okay, let's see what we do and what we don't know about degenerative myelopathy. Degenerative myelopathy is an ALS type disease, lateral amyotrophic sclerosis, ALS, okay? Lou Gehrig's disease, all right? Neurological loss of neurological function in old dogs. So it's a degenerative spinal cord disease. It is most frequent in the German Shepherd dog, the Boxer, Rhodesian Ridgeback, Chesapeake Bay Retriever, Pembroke Welsh Corgi and Cardigan, Bernese Mountain Dog, and others. Okay, these are where breeds that we have, documented histories where, eventually you see affected dogs in these breeds as a veterinarian. It is complexly inherited. No one has ever said from the beginning of any degenerative myelopathy research that this is an autosomal recessive disease. Okay, we knew right away that it wasn't because you look at pedigrees of dogs and it doesn't follow that pattern. But an autosomal recessive liability gene, a mutation called SOD1, has been identified in degeneromyelopathy. All dogs that are pathologically confirmed with degenerative myelopathy are homozygous for this mutation, have 2 copies of this mutation, so it's a recessive mutation. Every single dog confirmed with degenerative myelopathy has this mutation. No question that it's related to degenerative myelopathy. Okay? This mutation is the most common mutation found in all dogs. 7.8% of all mixed breed dogs have this mutation, and 5.4% of all purebred dogs have this mutation. Okay? It's the most common mutation found in all dogs. And what we know this because, remember when I talked about Mars and the optimum selection? So actually Mars is partnered with a company in Finland called Genoscoper. And everyone that's sent into Mars the mixed breed dog analysis test, what breed is in my dog, and now the purebred dog analysis tests with optimum selection, all of that genetic DNA data has been sent to Finland and has now been analyzed by Genoscoper, who's been doing the panel testing in Finland and in all of Europe, and now everything at Mars runs in the United States and Australia and around the world is all being sent to Finland for analysis. And so they've got hundreds of thousands of purebred and mixed bred dogs where they're looking at the full panel of 150, 160 different mutations. And what is the most frequent mutation across all dogs? The DM liability mutation. Absolutely, the most frequent mutation in the world. It has been identified in almost every single breed, the vast majority of which have never had a diagnosis of degenerative myelopathy. And in the breeds that have degenerative myelopathy, the shepherds and the boxers and so forth, the mutation frequency is exponentially higher than the frequency of clinically affected dogs, like at least 10 times the frequency of DM homozygous at risk versus those that are clinically affected. Okay, so this is a chart out of Missouri where they found this DM mutation, and it shows the frequency of that mutation across many different breeds. So wire fox terriers have a gene frequency of 94%. So 94% of all copies of this gene in wire fox terriers are the mutated gene. 0 wire fox terriers have ever developed degenerative myelopathy. Pembroke Welsh Corgis, boxers, these are breeds that have degenerative myelopathy, and boxers have 72% here, and Pembroke's, 79% here, but the frequency of DM is like 1.5 to 2%, whereas the frequency of the mutation is almost everybody. Okay, so it's very poor to use as a screening test even in the breeds that have DM, much less the breeds that don't have DM, and so forth down the line here. So Oravet in Australia, I just got this data last night, so I had to put it in this morning. So this is the results of SOD1 DM mutation testing in Australia, where they are testing diligently for this gene and feel that we all should be testing for it. And what they're finding is homozygous normal, 48.46%, carrier of that SOD1 mutation, 41.54%. So almost half your breed is a carrier. And then homozygous at risk, 7%. And this is based, if I look at this here, it's about 100 dogs, a little over 100 dogs that have been tested. And you guys have tested with some labs, probably paw print or some other labs. There isn't much OFA testing that you've done, but there's several different places that do test. So the frequency of the DM mutation is high in your breed, absolutely. Okay? There are, they say here over 20 breeds, but that's only because I think it's 21 now. But But this is from the literature. So and the testing company that found the mutation, and since they need more funding from the ALS Foundation, they need to make it into a bigger problem than it is. Okay, and it's a big problem, and it's a big problem for people too. But we can't make it more than the problem that it actually is. So the boxer, 45% of boxers are homozygous at risk. And this is a breed that has the disease, and we are concerned with it. 0.6% of boxers develop degenerative myelopathy. 45% at risk, 0.6% develop it. It's a very poor screening test. All it's telling us is that in the breeds that actually have this disease, there is a liability there. But even in breeds that have this disease, I say that you need to ignore this SOD1 mutation test unless you have close relatives that have come down with DM, because there are other unidentified genes that must be present to have clinical disease. And the majority of this 45% do not have those genes. And all of the Australian Terriers at this date do not have those genes either, so that you will never see them. That's an old slide, it's now 21. So 21 dog breeds where DM has been clinically confirmed. Actually, pathologically, I think 17 is still the right number. The over 20 is taking dogs that have a clinical disease, that have an abnormal MRI, and still do not have a definitive pathological diagnosis of the disease. DM has never been clinically or pathologically confirmed in any Australian Terrier. And I spoke to, where'd that other piece of paper go? I spoke to Ms. Lobegeiger in Australia, who runs the whole degenerative myelopathy testing website and is pushing for everyone to test. And and she knows that no Australian Terriers are confirmed, but there are dogs that have the signs. Okay, there are dogs that have clinical signs. I've gone over these things with her. DM is not a painful disease. More than half the dogs that she's looking at that have painful disease, that's going to be disc disease. It's going to be spinal disc disease. There is zero pain with this disease. These dogs are happy, but they're losing control of their spinal cords. There are other diseases that will, the bottom line is it causes weakness and paralysis. Okay, there are a lot of diseases that are going to cause weakness and paralysis of the hind limbs, and primarily weakness. And they're not DM. And so these dogs need to be worked up because a lot of these are curable, whereas DM is not. There is one dog that she thinks may have DM, and it's at an advanced stage, and so I've arranged with her, we're gonna get that dog to veterinary pathology laboratory at a vet school in Australia and come up and see if we can get a definitive diagnosis. I'm more than happy to help confirm the disease in your breed, but it has not happened. And I question whether it's gonna happen. Because with the frequency of the DM mutation in your breed, you would think that someone else would say, we have a confirmed diagnosis here. And the pathologists are looking for it, and they're not seeing it. There's no reason to test Australian Terriers for the SOD1 mutation. And the genetic testing companies that are pushing you to test it, they make money every time you test your dog. Okay? So they're looking to get you to do more testing. But it is the wrong thing to do because it is not a gene that needs to be tested for in your breed. And when panel testing becomes the gold standard, it is a gene that your breed's going to have to ignore because that gene occurs in every breed and it does not cause disease in your breed unless or until we see that it does. And in that case, if we have a 0.1% chance of having that disease, then that's something we deal with. But we still don't deal with getting rid of over 40%, 45% of your breed because they're carriers. It is not something that you want to arbitrarily be selecting against. I can tell you right now, I don't want you breeding any dog that has an S in its registered name. Okay? I'm serious. I am serious. You guys should not be breeding those S dogs. It is the wrong thing to do. You want to breed quality dogs, you need to avoid all of those dogs that have an S in their name. Absolutely. There's no question about it. I stake my reputation on it. That's exactly the same situation you're dealing with DM right now. There is no, it's arbitrary, and there's absolutely no reason to be selecting against those dogs. Yes?
So the only way to really definitively diagnose DM is on necropsy?
Yes. The only way to definitively diagnose it is necropsy or pathology.
And has that gene mutation ever been associated with any other disease?
No. That mutation actually is associated with ALS in humans. That's why they first identified it. It's not associated with any other disease. Yes?
So they're carrier, positive and clear, is that the deal?
Well, when the folks at Missouri first identified the gene, they wanted to call it affected, and we convinced them to call it at risk, because people are going to think that their dogs are affected or are going to be affected, and it puts a lifeline and emotional stress on an owner to say my dog's going to become paralyzed when it gets older, and it never will.
So theoretically then, carrier to carrier shouldn't be a problem?
No, carrier will never be a problem, even
But
in
at risk to a carrier may be a problem?
in the breeds that have the other genes that have clinical disease. Yes. So that is the story of DM in your breed, and I wrote an article. It didn't include the Oravet testing results, which I just got last night, but the message is the same. This is not a gene that you need to pay attention to, and I also would ignore Dr. Bell's advice about not breeding dogs with S's in their names. Okay. All right, so those are the major diseases and what has been reported in your breed. Now let's talk a little bit about breeding. And in order to talk about breeding, we need to talk about a little bit about the ethics about it. So responsibility, if you look up responsibility in the dictionary, it says duty, obligation, and burden. And so what we need to ask ourselves is, what is the obligation for breeders to do genetic testing? Breeders are the custodians of their breeds and their gene pools. Okay, you are the custodian of the Australian Terriers. If you're breeding, you're in charge. All right? As veterinarians, we take an oath, above all, do no harm. I think doctors might take that oath too. Okay? Breeders must be you need to do the same. You need to not harm your breed with how you are breeding. You have to use genetic tests for the best interests of your breed. What is the expectation of the general public? So I went to Google Image, I put in general public, and this is one of the pictures that came up. I've got no idea. But the general public believes that quality control for genetic disease is being done. That if you are breeding, you are doing quality control for genetic disease. And that, unfortunately, is not the case. Hopefully it's more the case for those of you in this room and in the fancy, but it is not the case in dog breeding in general. It is the ethical responsibility and obligation of all breeders to perform the available, required pre-breeding genetic health tests on prospective breeding stock prior to any breeding. Pre-breeding health screening should be as universal as equine pre-purchase exams. So the OFA, one of the mottos of the OFA is health tested parents for healthier puppies. You don't get health if you're not breeding health. Okay, and so this is what we need to do. We need to breed health. All genetic disease cannot be prevented. However, we have the knowledge and the tools to improve the genetic health of puppies. Who is a reputable breeder? It's one that does genetic testing. That's what a reputable breeder does. If not, you need to find a different hobby or profession that you can actually be good at. Okay, if you're not willing to do genetic screening, then you need to find something you can be good at, because you're not good at breeding. You're not. Okay, it's not just breeding a winning dog or breeding a nice dog even. It's about breeding a nice, healthy dog. This is the responsibility of being a breeder. Many health tests can be performed during examination with your own veterinarian or obtained inexpensively at local health screening clinics. The OFA has, on the OFA site, has a list of health screening clinics, but the best one, if you're looking for screening clinics, is the caviarhealth.org website. You go to this website, they have every single health screening clinic in North America, okay? Listed by state, city, province, listed by the dates, by what tests are being done, by who the examiners are. by what the cost of each test is, who to contact to register, it's the best site. If you're looking to get all your health testing done at a dog show or somewhere, you go to cavalierhealth.org and you will find out where all the screening tests are being done. And in one afternoon, you can get all your screenings done on prospective breeding animals at an inexpensive price and be able to know what you have. And that's what you need to do. It's not, who am I eliminating and who am I using? It's knowing what you have and making informed breeding decisions. So let's talk about managing genetic disease. That's not what this dog is managing, but anyway. So managing dominant genes. So if you have a gene where one single gene from either parent causes a disease, you want to replace affected breeding dogs with normal siblings, a normal parent, or a prior born offspring. So you don't want to breed an affected individual because 50% of their offspring are going to be affected. This is the one instance where I'm telling you don't breed that dog. Because most of my recommendations is not how do I not breed my dog, how do I breed my dog and get away from this disease? And there are ways to do that, except with a dominant gene. And some of the dominants that we have issues with are incompletely penetrant dominants and our late onset dominants, where they're breeding before we know that they're affected and before we have a genetic test for it. So in this instance, it's a late onset disease. This male right here was a quality male. He was already bred, had 2 litters before the test came out and before individuals were identified as affected. So you don't want to breed him again. Is there semen or is this the father available? Are these bitches available for leasing or for breeding, or prior born normal offspring? That's how you maintain the line but avoid and get rid of that genetic disease. With recessive genes, if you have a test for carriers, you want to breed carriers to genetically normal mates, and you want to replace the carrier parent with a quality genetically normal offspring. And select against putting more carriers for breeding into the breeding pool, because again, carrier to normal, 50% carriers, that's much higher than the frequency of most defective genes in populations. So when you have a genetic test should increase your choices, not decrease them. So this is something we need to get over, the emotional aspect of the fact that my dog is a carrier. Without genetic tests, the effective selection on the gene pool is minimal. But with genetic tests, if everyone decides not to breed carriers, it can have a significant limiting effect on the gene pool, where you're eliminating a lot of dogs, where you can breed those dogs to normals, never produce affecteds, and then select a normal testing offspring and replace that dog, carry on that line, and never produce that disease and lose that gene. And that's the proper way to use a genetic test. And you know what? If the best quality offspring in that mating was a carrier, because 50% are, and it's better than the parent, then you replace the parent with the better offspring, who's still a carrier, and then in the next generation, hopefully produce a better offspring that you can replace and lose that defective gene. If a breeder was planning on breeding an animal prior to receiving the carrier results, the proper response is to breed to a normal individual and eventually replace the parent with a quality normal offspring. If you're a health-conscious breeder and you're doing your due diligence and you test for a testable recessive gene, and the result that causes disease in your breed, not like the SOD1 mutation for DM, but that causes disease, and you get back a carrier result, in your mind, that dog is now diminished. Okay, it's not the dog that you thought it was because it carries a defective gene. You can't let that change your decision. You already decided this is a quality dog that I'm going to use for breeding, and I'm doing my pre-breeding screening on it. It doesn't change who you breed, only who you breed to. All individuals, each individual is not an eye or a hip or a heart. Each one carries tens of thousands of genes, and each is part of the breed's gene pool. You must consider all aspects: health, conformation, temperament, working ability, and making breeding decisions based on a single testable gene is an inappropriate decision. So this is the quote from Dr. Henthorne from UPenn, actually. For recessive diseases, a direct genetic test should not alter who gets bred, only who they get bred to. So if they test as a carrier, you want to breed to a normal. If they test as affected, You know, if you want to deal with 2 generations before you lose the gene, you can breed an affected to a normal. You'll never produce more affecteds if it's that quality of a dog, even if they're clinically affected with PRA or with some other disease, and they'll produce all carriers. And then you replace them with a carrier parent, carrier offspring for breeding, and the next generation breed that carrier to normal. Now, it's not for everybody. That's a long-term breeding plan to get rid of this gene. But if you absolutely are in love with that one dog and want to carry it on, it's a viable way to go. Genetic registries. So the OFA used to be the Orthopedic Foundation for Animals. If you look at our website, you look at everything else, you never see those words anymore. We are now OFA, the Canine Health Information Center, which is CHIC, which is what we've run all along. And so this is what OFA is about. And I want to go real quick on the website. Because if you haven't been to the website in the last year or so, you should go. It's much different. This is the website now. Health Tested Parents for Healthier Puppies, OFA. Up here you can type in the registered name or number of a dog. You can use advanced search. If you look here, what genetic health screens should my breed have? So those are the CHIC requirements. What are the health statistics for my breed? So it shows you all the test results of the databases for your breed and what health screening results are recorded in the OFA database. If you are a breeder, all of your breed-specific information is here. If you are a veterinarian, all of your veterinary-specific information is here. If you are looking to purchase a dog and are interested in a breed, all of your breed-specific information is here for an owner, directed specifically to those audiences. And OFA is a very powerful website. If you go to your advanced search here, okay, you can search by breed. You can search for only check off or CHIC result, only CHIC qualified dogs. You can check by specific disorders, specific tests. You can check for specific results of different tests. So it's very, very powerful. If you're searching for a dog that has certain things and doesn't have other things, if your dog has certain things, doesn't have other things, you can look for prospective mates by looking at that OFA website based on individuals being in the OFA database. Okay, so the CHIC DNA repository, I need to talk to your breed about this. You guys don't have a DNA repository of stored DNA on your Australian Terriers. You really need to do that, okay? Because even if you want DNA research to be done on diabetes, it won't get done for another decade because you need multi-generational DNA from families. And most of those dogs, the parents, grandparents, full siblings, you don't have control of those dogs. A lot of those are pet dogs, you no longer have control of. You need to be drawing blood on your litters and sending it in. The OFA DNA repository, there's one cheek swab on our Australian Terrier in the DNA repository. And we have hundreds of thousands of DNA samples, okay? And so we recommend that the CHIC repository, because it's not for profit, the use of those DNA samples is dictated by your parent club and or by the Canine Health Foundation. If you have breed-specific research that's being done in your breed, which only is going to get done through your club approving it, then those DNA samples are available to the researchers. But you're not going to get, there's a lot of Canine Health Foundation supported research that has been funded and granted that has never been done because there's never been enough DNA available to actually do the research. So you need to start drawing DNA at your specialties, at your shows, of your litters. You need to get DNA into a repository. You actually own that DNA. If your dog passes away at some point and a DNA test becomes available for diabetes and you want to know who carried and who didn't carry those genes, you contact the OFA and they will send that DNA to the laboratory for you and you can have your dog tested. you still own that DNA in that regard. You can control and have DNA done on your dogs, or have a panel test done on it, so you know the background of your dogs. But you can't do it without a repository. So it's really important that you guys start building up a DNA bank on your dogs. So it's got to be multi-generational in order to really do good DNA research. So the Canine Health Information Center, CHIC is the standard of care in health-conscious breeding. It's an open health database for breeds. Included disorders and means of diagnosis are determined by your parent club. Animals can receive CHIC certification based on completing the required genetic screening regardless of normal or abnormal results. That's the beauty of the CHIC program. Because as more testable disorders emerge, every individual is likely to carry some deleterious genes. So CHIC is not about health normalcy, it's about health consciousness. And once we get past the view of my dog is perfect and your dog is not, then we can start realistically dealing with genetic disease as a community of Australian Terrier lovers and breeders and work away from these disorders. So CHIC requirements for an Australian Terrier, an eye exam, patella luxation, and a thyroid profile. Is the thyroid profile the most important thing to run on your breed? As I said, probably not. It's good that you're running them though, so you do know who is affected and who isn't. And you need to ignore those equivocals or retest them at a later date because those are not telling you that you have autoimmune thyroiditis. 146 Australian Terriers have achieved CHIC certification. Now, I did an analysis based on the data sent to me from the AKC, where I've set up what's called a CHIC ratio, a CHIC breed ratio. And so what I've taken is the number of dogs that have qualified for CHIC over several years in your breed, and the number of unique dogs that have been bred in your breed. So if a dog is a repeat breeding, you don't count it twice, just count it once. So the number of dogs that have CHIC certification divided by the number of dogs bred. And it's not just your club members, it's AKC registered dogs that have been bred, Australian Terriers. Your breed ratio is 0.31. So 1/3 of your breeding, of the Australian Terrier breeding dogs have a CHIC number and where the breeder has completed the CHIC certification. That's a good number. But honestly, it doesn't sound, 2/3 of you of the breeders have not done CHIC certification. But honestly, we're really in the early stages of getting this pushed forward, and compared to your breed, it's a good starting number in that regard. So we need to increase that number. You need to get CHIC certifications on all your breeding dogs. The Bred by Heart program by the AKC is their way of promoting health-conscious breeding. At some point, CHIC and Bred by Heart are going to somehow be combined because Bred by Heart's using the CHIC database to verify the Bred by Heart requirements, and lo and behold, Bred by Heart by your club, you're answering the same question that you're answered for CHIC. What are the important tests? An eye, a patella, and a thyroid. And so those are requirements for Bred by Heart as well. So let me show you, so I picked 2 dogs on the OFA website just to show you what you see on the OFA website and how you can utilize that. So if you're lucky enough, I picked one of your dogs. So this dog is Red Hawk, Red Sky, Purple Heart. Does anyone know who this dog is?
I think I do.
Okay, so this is a female who was born in 2015. Okay, it's got her sire and her dam there. If you pay $10 to the OFA, that $10 goes into the Canine Health Foundation Donor Advised Fund. So that will fund research, and your club determines where it's like you donated to the Canine Health Foundation for your Donor Advised Fund. But you get your dog's picture here. This is your dog's webpage. This is Facebook for dogs. Or this is Tinder for dogs, maybe. So this is her webpage. It shows her information. It shows that her test results, she has her eyes done and the date of it, and what the findings were: normal eyes, normal thyroid, and normal patellas. Okay. It then has her sire and her dam, and her sire has CHIC, which means it has eye, patella, and thyroid done. The dam does not, and it shows the results of the hips, the eyes, patella, and thyroid. So no patella on the dam. It then shows the full siblings, the half siblings by the sire, the half siblings by the dam, and the grandparents. And if this dog were bred, it would show the offspring and all of their test results. So this is giving you that full pedigree information of the test results. And for complexly inherited disease, this is what you need to be looking at. What is the family showing? Is the disease present there or not? Up here, you can click vertical pedigree. So this is a vertical pedigree which shows you the pedigree with the results. And we can do it for hips, cardiac, eyes. Patella is what you guys are interested in. So this is her result, is normal. She has 3 siblings and no results on the siblings. 3 siblings in the OFA database. We have the sire is normal, has 1 sibling, no results, has 9 offspring, 4 of which are normal. The dam, no results, 1 sibling, grade 1, 6 offspring, 3 normal. Here's paternal grandsire, 1 grade 1 unilateral, 10 offspring, 1 grade 1 unilateral, 7 normal. Paternal grandam, normal, normal offspring, nothing for maternal grandam, nothing for grandsire, nothing for maternal grandam. But you can see here how this gives you the depth of the sire and the parent and the grandparents, as well as the breadth, the litter mates, as well as offspring of those individuals to tell you what type of genes they are passing on in that regard. And certainly offspring, only 50% of the genes are coming from your dog, your dog versus who you're bred to, but you know who you're bred to, you're trying to breed to normals, so you need to look at everything and give you the most data that you possibly can have. Okay, let me go back here. And I'm gonna do one more. Right time here. Okay, I'm gonna have to move through a little bit faster to finish this stuff up. Okay, so the second dog I picked was Reba's Call Me Irresponsible, and I picked him because he had his pick. He was one of the 3 dogs, Australian Terriers, that had their picture up there, and I wanted to show you what the picture looks like on the database. And again, you've got good hips, normal patellas, normal thyroid, surf tested, and again, 2 thyroids, 2 years apart, 2011 at 80 months of age and 2013 at 100 months of age. So, telling you what those results are, as well as, here are the offspring. This dog was bred. You've got grade 1s in here. You've got, you have the abnormal results listed, which you want, as well as the half siblings through the sire. So this is how you get that information on the website. Yeah, close all those. So the authorization to release abnormal results. This is on every OFA application. You need to initial that. If you're hiding results, abnormal results, you're not helping yourself, and you're certainly not helping your breed. Okay? These diseases occur in your breed. They occur with frequency in your breed. And the only way you can select against complexly inherited disease is knowing the frequency and the relationships of affected dogs in your breed. And so hiding that information doesn't help you. It doesn't help your fellow breeders. Yes, I've got patella, or I've got thyroid, or I have whatever, and and I'm trying to work away from it, and let's work together on this. For hips, the OFA tracks how many people check off for open reporting of results. And so you don't do a lot of hips. Some years you don't do any hips. So, and then other years you have 0% checked off for open reporting, which meant 2 people didn't check off or 6 people didn't check off. But when you do check off, you are checking off at a higher frequency here. So I'm pleased with that, because the average for all breeds is about 23%. Only 23% of people that submit to OFA hips check off for open reporting. So we need to change that paradigm and talk about open reporting. As long as we keep problems secret, we will not be able to deal with them. There's something secret in that barn hunt test there. Breeders need to be informed about the problems occurring in the offspring that they produce. On the birthday of every single litter that you have bred, you should contact your pet owners, the owners of everyone that you've bred, your last contact information, a phone call or an email. How is so-and-so doing? Okay? By making that contact, you are showing you're a health conscious breeder and you want to know about the health of the dogs that you've produced. There's no other way you're going to know that without making that contact. And if something bad has happened, then you can commiserate with them and maybe even help them along with some information or whatever. You're not going to get blamed as a breeder if you're making that contact and saying it's important to me to know what I have produced so I can ensure that I'm producing the healthiest dogs that I can. So it's a very important thing. It's the only thing that distinguishes you from commercial breeders, is your ability to connect with your puppy owners. I know it's a weird statement to say, okay? But as a breeder, I mean, yeah, you show your dogs, that's fine. But as a breeder, that's the only thing different that you're doing is your ability to contact the owners. I mean, some commercial breeders, a lot of them do health testing as well, but they have no idea what they produce because their puppies are gone for commercial sale. The days of stigmatizing conscientious health testing breeders who have produced dogs affected or carrying hereditary disease are over. And I know that's a pie in the sky statement of mine, but that really is where we are today. Okay, so if you're hiding it, and then all of a sudden dogs are coming up with disease, and then word gets out, her dog had the disease, and wait a second, she never told me that happened. It was never on the website. And now the stigma is with those of us that hide those diseases. So using genetic tests, if you have a direct genetic test, a test of the genotype, you only need to know the results of your breeding stock. Do your genetic testing and find the results. If you have, on OFA, you can do parent tested normal. If both parents are tested normal, you don't have to test the offspring. They're parent tested normal. But the next generation, if you want to breed, you need to test again. So you can skip every other generation and still get certification. For phenotypic tests, linkage tests, or no tests for carriers, you need to know the test results and carrier or affected status of relatives. So that is important. Without tests for carriers, you want to breed a higher risk individual, a quality higher risk individual to a lower risk individual. You want to replace the higher risk individual with its lower risk offspring and repeat the process in the next generation. It requires an open health database where people are reporting who has patelloluxation, who has thyroid. Otherwise, this doesn't work, okay? Relative or recurrent risk analysis, I'm not gonna go into it as much because you guys don't do it, but there is a way to do an analysis based on a pedigree to figure out for a simple autosomal recessive disease, what's the risk of producing affecteds and what's the risk of producing carriers. And as long as I have breeds that never found the gene for certain recessive diseases where we've virtually eliminated those diseases from the breed by using relative risk analysis, and all you need to do is breed to dogs and breed on average matings that are lower than the average of the breed for risk. And by working away from the risk, you're working away from the problem. Relative risk analysis allows breeders to objectify their risk. The cons is that it selects against families. So you're selecting against normals as well as carriers, but if you don't have anything else to select against, at least you know where that risk is. Oops. Oh, come on. So sex-linked genes, it's the same breed and replace, and this is in the handout. I need to go a little faster because we're running out of time. Using a normal male will always lose the defective gene if you don't have a genetic test for an X-linked gene. The problem with X-linked disease is that carrier mothers, if you can't identify a mother who's a carrier, or if you have a mother that's at high risk of being a carrier, 50% of carrier mothers' sons are affected. And because we don't want to produce more affecteds, you really need to select strongly against high-risk females, and using a normal male always loses that gene. And lastly, polygenic disorders. You want to identify phenotypic traits tied to the underlying genes in the pedigree. Phenotypic breadth of pedigree provides more information on the possible range of genes carried, like I showed you on the OFA website. You want to treat disorders as threshold traits, where several genes have to add up to cross a threshold to produce the disease, and you want to breed normal dogs from mostly normal litters. So let me back up for a second. So for breeds that have hip dysplasia, I talk about identifying phenotypic traits tied to the underlying genes. So there isn't an OFA excellent gene, okay, or an OFA dysplasta gene. So different things are going to combine and amount to hip dysplasia. So if your dog has fair hips or mildly dysplastic hips, you need to know why. So you need to look at that x-ray with your veterinarian, or even call up Dr. Keller at OFA so they can point that out. If there's laxity, if there's subluxation, maybe you need to get a pen hip done and objectify that laxity and breed to a dog with a tight hip. If you have a shallow socket or acetabula, maybe you need to look for a dog that has a deep acetabula and breed for deep hip sockets. So you want to break down the component of the phenotype to things that might more accurately reflect the genes that you are inheriting, because every dog does not have hip dysplasia due to the same causes or genes. Depth of pedigree, some will say I've got 3 generations of OFA normals, but that only tells you about single individuals, whereas breadth of pedigree gives you more information about the range of genes that can be carried by the individual dog. So this dog is normal and has a preponderance of normals in its siblings, whereas this dog is normal, has normal hips, okay, but its siblings were all dysplastic. So which dog would you rather use? You really need to be concerned about the amount of dysplasia liability genes that this dog, even though it passed OFA, has, and what it's going to pass on to the offspring in that regard. So again, this is where vertical pedigrees help you out on the OFA website, and you're using depth and breadth of pedigree information. There's moves to use estimated breeding values. They're trying those in the UK and other European countries, and Dr. Todd Hunter at Cornell is trying to work with it. It's what we use in livestock breeding, in milk production, egg production, and has tremendously, worked us, into much better, aspects of breeding for positive traits as well as selecting against negative traits. But the issue is, for estimated breeding values to work, you need to have all of the siblings in there. You can't just have individual dogs. Estimated breeding values don't work based on individual dogs. So the reason why we're not utilizing that as much is that it gives you false results, because there's just so much missing data, because we don't have all of our pet dogs being radiographed or being tested in that regard. Phenotypic disorders, polygenic disorders are threshold traits. A number of genes must combine across a threshold to produce an affected animal. Let's say if there's theoretically 5 genes that have to combine to cause a genetic disease. If you have an affected dog bred to a normal, it's no surprise 7 plus 3 is 10, divided by 2 is 5, that on average you're going to see affected individuals in the pedigree. But with any complexly inherited disease, what you need to understand is, if 2 phenotypically normal parents were bred together and they produced an affected animal, both parents had to contribute liability genes to produce that affected individual. It wasn't just that damn stud dog that you bred to. Okay? So in complex disease, if 2 phenotypically normal individuals produce an affected, both parents had to contribute liability genes. And then this real fast, this is a chart. I don't expect you to see it all. It's from an article, it's on the OFA website, where we looked at almost 500,000 dogs of all breeds that had OFA ratings, where both their parents also had OFA ratings. And what we did is we graphed the DAMS rating from excellent for 1 to severe to 7 against the sire's rating, excellent for 1 and severe being 7, and the percentage of dysplasia that was produced based on the different matings. And what we found is that the combined parent score, so adding up a good for 2 and a good for 2 from both parents, or a fair for 3 plus a good for 1 for both parents, all had almost the exact same frequency of dysplasia. And dysplasia is inherited as an additive gene. One thing I need you to look at, though, is good to good contribute about half the database, almost 250,000 dogs. Whereas moderately severe to severely severe was 52 dogs or 49 dogs or 18 dogs. So the reason I wanted you to see that is that this is an exact linear correlation of the combined parent score for hips and the frequency of dysplasia that they produce. And the only outlier is for a grade of 13, which is a severe to a moderately dysplastic, based on a very limited number of dogs. But hip dysplasia is a linearly inherited additive disease based on the number of liability genes inherited. And if we ever identify those genes, we'll be able to work away from it. But a fair dog has more liability genes than a good dog, and an excellent dog has the least number of liability genes. There is a difference between those grades. And if we look at how many grandparents have normal hips, that combined score goes even further, where 4 grandparents with normal hips out of 2 excellent dogs has the least dysplasia versus 4 grandparents that don't have any hip results, and so forth down the line. So it's all depth and breadth of pedigree normalcy. In closing, breeders should use health screening tests to identify carriers or risk of carrying disease liability genes, work to breed away from the defective genes, and prevent the reintroduction of genes in future breedings. Each breeder must assess their own breeding stock and determine their own rate of progress. Replace carriers with normal testing offspring and decrease the carrier frequency or carrier risk with each generation. A healthy breeding program does not continually multiply carriers, does not limit the genetic diversity of the population, and is geared towards producing quality, genetically normal dogs. Some of you may have more issues with patella. Some of you may have more issues with diabetes. We're all dealing with different percentages of the common disorders in your breed. Some of you might be having problems with a very rare disease that happens to be genetic. So everyone has to work a little bit at a time to improve your own situation, and in that way, as a breed, the entire breed will become healthier. How can we educate the public? That's the last thing that we need to pay attention to, because the public still buys on the internet. The public doesn't know to look for health conscious breeding, and we need to educate them. And so when the public contacts you, whether you have a puppy coming or not, it is a moment, an educational moment. Make them more informed consumers of dogs and puppies. Let them know what they need to look for when buying from a breeder. To identify a health-conscious breeder, able to discern responsible breeders, knowledgeable about genetic testing that's specific for your breed. So that's really important. And that's the end. or the ends, I guess. Okay, I went over by 4 minutes. I will entertain some questions if you want, or if you want to come up individually for some questions, I can do that as well. It's up to you.